Hello, everybody. My name is Barb. I am a social worker here at Siteman Cancer Center. I work in the West County location, one of the satellites here at Siteman. So I wanted to just kind of start with explaining a bit about like what I do or what I tend to do here at Siteman in my role. And then just talk a little bit about some, things I've kind of come to find some good sort of tips on how to talk to loved ones about cancer. Can you guys see my screen? Okay, is it okay?
Yep, all good.
All righty. So go to my next slide here. Okay. So, as a social worker here at Siteman, what we do is we're basically here to help patients, families, and caregivers cope with the distress and challenges that come with the cancer diagnosis and treatment. So, from sort of the beginning to the sort of throughout the time you're in treatment and care at Siteman, and even at discharge or transition time, we just kind of help in that process. We're a good support. We try to remove barriers to treatment and just all those ups and downs that can happen through cancer care. People are sort of connected with us by referrals from either the doctor, the nurses, or any other team member. They may think of us as a good resource and help through with either practical resources or just kind of emotional support. All right. Okay. So I kind of look at it in like three categories here. One sort of category is functional and emotional support. So when I look at that, that's kind of what ties into this presentation, like just that time to have someone to talk to. I often find that the setting here at Siteman is an opportunity just to, sort of talk about how we're feeling or how either the patient or the family members or caregivers are feeling. And then we also connect people with good resources such as, Siteman Psychology Service, Cancer Support Community, and also some, good sort of online resources for support. We help with lodging and transportation. That is definitely a big one. We're, you know, see patients or people coming from very far distances. So we try as much as possible to help them maintain their treatment by setting up, Hope Lodging, ride service that typically is maybe through their insurance or through other, good resources here in the community like Peregrine Society. Financial is a biggie. So that's one where it's a big one more recently that can cause a lot of stress for people. So helping people navigate insurance challenges. Sometimes medications are not, covered 100%. So we help with finding some, grants or foundations for that. And just food, food resources, transportation costs, a lot of those sort of practical financial supports. Okay, so this is just a tool that we use, an example of a psychosocial assessment. So, we start with getting the demographic information, assessing for any safety issues, and then just really kind of get a sense of the living situation. And then that's kind of where we get to a little bit more information on any sort of barriers such as transportation, any just perhaps physical issues that could be going on that someone may need more support at home or help with any physical issues or physical therapy, things such as that. We look at the support system, try to see who's already there to talk with and who can be supportive during the appointments. Like I said, insurance issues, that's definitely a big thing now, especially at the beginning of the year. And then looking at medication issues, food insecurity, employment status, that's definitely a big one as well. We help just in navigating those challenges with FMLA, sometimes, applying for disability income, and just finding some good, resources online in particular for employment challenges. And then again, so just looking at just what's going on right now and what are some possible barriers to care. And so I'll kind of scroll down here, but to the part where, usually this is where I start to engage in conversation about, how do we feel? How are you feeling? I think a lot of times, the start of treatment is overwhelming. I mean, there's, a lot of appointments, labs, scans, tests, and then the point of, making decisions with your care team on, treatment. So, I kind of find like, uh, those are sort of moments of, what's your understanding of your diagnosis, and, how do you feel about it? So that's kind of where I kind of, lead into our discussion today. Um, is just how do we go about this? Like, how do we talk about it? Who do we talk to? And, what's it going to look like through the cancer journey? So, a couple of, considerations I kind of think of as just, how we feel, like kind of checking in with our emotions. Or, it's okay and common to have multiple emotions, fear, anger, you know, sadness, it's a lot. And then, knowing that also physically we're going through some changes. So that can impact how we feel about, our diagnosis and our situation. So so it can be kind of a big decision, and or it could feel overwhelming. How do we talk about it with our close, families, caregivers, and friends? Um, so I think one of the main kind of benefits could be to, alleviates that sense of isolation. So sharing our diagnosis with just trusted family or friends can just really provide some comfort and feel sort of help us feel less isolated. It also just allows the opportunity just to get the language, I think the more something is new or scary, the more we, understand, and then we talk about it, it can become more comfortable. And then if we talk with others, they also become part of our team. And this kind of shared understanding can help, improve just our ability to sort of cope and also communicate with, the treatment team along the way. So, so really, that's, I think, important, or could be important first step. And then, uh, definitely, I think planning ahead, you are in charge, with this conversation. I kind of look at it as finding the right moment, the right place, the who, what, how, who, what, when, and where. So, just really thinking about what you want to share, um, what the details you want to be, and then like the treatments or your prognosis. There's a lot of things you could share. So how who you pick. It's always good to plan ahead. And even just, starting with writing down a list of people, perhaps the people that you're closest with first. And then, like maybe your second sort of tier, of people that your friends or your other supports. And then also there's, like another category probably of your day to day, maybe your work, how you want to navigate or what you want to say to your coworkers. Um, Having a lighting issue. Yeah, my room. So there we go. So, so really just kind of planning ahead, and then, um, uh, what you're comfortable sharing and how you want to share. Okay, so I came up with these just sort of 6 categories of tips. So like I said, kind of first, kind of being like, it's probably safest to tell people how you're feeling, the people that you're choosing, people that you're closest to. And if it's not, not quite comfortable yet, there's a lot of support. There's support groups, there's mental health counseling, there's, different channels and supports that can help you practice these conversations or navigate these conversations. Um, Finding out what works for you, right? So everybody is different. That is for sure. And you may find that, there's certain things you're comfortable talking about, other things not so much. And uh, being prepared, for the responses you may get from people. Um, so I think there might be, that challenge with setting boundaries. And that's definitely okay. Uh, and then also being prepared to know how to respond if someone wants to offer help. I think that's important, because some people may ask that question, how can I help? Having specific things, like transportation, or, coming with me to my appointments or to my treatments, helping around the house with, chores, that type of thing. So just kind of being prepared, to answer those questions. Let's see, and then also, I think to this, yellow square here, kind of being mindful of those resources, and sharing those with your support people, um, yeah, if they're just learning, as you're learning as well, knowing that they have connections to, a multitude of websites and, American Cancer Society, um, yeah, and they can learn along with you. Knowing the top, so, and then back to this, communication, um, topic there, it's okay to know, like, that there's other channels that you can communicate with, support people with. So there's, obviously, text messaging, group emails, social media chats. Caring Bridge is a good tool that people can use where you can, essentially create your own email system to communicate. So you don't have to be sharing, all the updates constantly. Knowing the topics that bother you. I think this is a good one, like your sort of trigger points. So just kind of knowing, it might be sort of, you know, um, uncomfortable if someone, says something like, um, uh, you know, they ask you, question your treatment choices, that it's okay to set a boundary if you're getting, into a conversation with someone that's, too personal or too uncomfortable. Um, just kind of having those phrases prepared, things such as, I get really tired of talking about, I really get kind of tired of talking about, cancer. Can we talk about something else? Changing the subject. It's absolutely okay to set those boundaries. So that's kind of where I'm getting to, this next part, like, just, it's important to, like, when we're sharing with others, that we do sort of check in with them and ask them how they're feeling. Um, and just kind of being prepared for, for that, for their responses. Um, because with that, then that will help us sort of, create, be support for each other through as a team, because they may have some triggers, or some discomfort as well. But again, it being okay with communicating those boundaries if it's, a lot that you're getting from your support person. It's okay to say, you need to kind of focus on your self-care. Um, and kind of to that point, it might be, kind of smart too, as you're sharing, like that, you have a spokesperson, someone that can maybe pass on information or share updates, as like a spokesperson, on your behalf. Um, And just kind of this sort of, last point, um, like talking to family, as we're talking to them about, how we're going through, our cancer journey, that we encourage them to keep life as normal as possible, and encouraging to do things routine, um, you know, participating in hobbies without, feeling guilty, just kind of those things that, so then they're kind of taking care of themselves as well. Um, let's see. And then I did have a slide here about tips for talking with children and teens, um, which you'll probably hear more about with the next presenters. But I think bottom line is, your children, and it's important to kind of look at, their age and developmental stage and maturity. Um, and you just might want to, just kind of keep things a little simpler when talking with them. So just making a plan, setting the stage, and starting with the need to know, find it, like I said before, kind of finding the right time, a good time when they're ready to listen. Um, and then just being as clear as possible, sharing expectations, preparing for change, what to expect. Um, and also just kind of providing choices when possible. And, just wait the day to day, like what to expect in the day to day. And then also, keeping things as consistent as possible in the day to day with routines. And I think it's just being open to their questions and feelings, and also, sharing our feelings. We're human, and just be honest with kind of how we're feeling, and then opportunities in that sense to model, you know, uh, emotions and coping strategies. Um, and then definitely using supports, there's a lot of resources for children and teens that are going through this. Um, so, and then the resources I looked at were, a lot of through the cancer support. Siteman Psychology is the resource that we tend to have, and are as an option for patients. That's individual, therapy, and for the patient as well as family or supports. There's Cancer Support Community that has a lot of good programs. They have individual, counseling as well as group programs for families and caregivers as well. American Cancer Society, within their, programming, they have Cancer Survivors Network, which has a lot of good resources for, having these conversations and practicing these conversations and building support. The Caring Bridge, as I mentioned, is a whole system where you can, create like a website and be able to communicate your cancer information and treatment information online. Pickles Group is, it's a really good resource in sort of navigating and coaching, talking about, cancer and treatment. There's, kids can have peer support through that program. And then Cancer Care, I just use a lot of their information when looking at this topic, and National Cancer Institute as well. So that's.
We'll start off by introducing ourselves. My name is Caitlin Payton. I'm the program director at Annie's Hope, the Center for Grieving Kids. I'm an art therapist and a licensed professional counselor in the state of Missouri. And I'm also a national certified counselor. And I've been with Annie's Hope for about 8 years.
Hi there, everyone. My name is Tracy Gomillion, and my educational background is in social work. And I've had the privilege to work with youth serving nonprofit organizations for the past 15 years or so. And I've been lucky enough to be at Annie's Hope for the past 2 years, working as the Horizons coordinator, which is our anticipatory grief program, working with kids and families anticipating a life-limiting illness.
So to share a little bit about Annie's Hope, the Center for Grieving Kids, we're a St. Louis-based nonprofit, and our mission is to provide comprehensive grief services to children, teens, and families who are grieving a death. And our vision is to be the first choice bereavement center focused on the needs of grieving children, adolescents, and their families in the St. Louis region, to lead transformational change in the way that our region views, acknowledges, and responds to grief, death, and dying. Annie's Hope has celebrated 28 years of service in St. Louis. We started as a grassroots organization that was founded by our executive director, Becky Byrne. And we're a small but mighty team. We've got about 12 staff members, and we have about 200 volunteers that help to support our programs annually. And we serve about 3,000 individuals each year.
So we're really proud at Annie's Hope to provide 10 different unique programs to support kids, teens, and families who are either grieving a death or anticipating a death. Horizons is the one program that works with families and kids and teens prior to a death occurring. So those are for families where someone in the child's life has a terminal diagnosis. And we will travel up to 60 miles to provide in-home support or meet wherever the family is most comfortable. And that support is really child focused and customized towards what that family, their unique needs, and desires for what they want to do, whether that be legacy creation of pieces, of keepsakes, building coping skills, or expressive activities. Additionally, we have a couple core programs that I want to mention. The first being our family support group program. We offer these 8-week-long sessions 5 times a year at our offices in Glendale in the evening time. And we also have a school support and education program that provides a variety of services, but we're most well known in that for our providing in-school grief support groups that last 6 weeks long, as well as crisis intervention and staff education. And then we also offer Camp Courage and Camp Courage Teens, which is typically the first 2 weeks of June. And that's a typical summer camp just with grief activities interspersed in. And then we also offer 4 teen retreats, which are overnight weekend programs for those 13 to 18-year-olds to really offer them unique programming for them as well. We also have a community resource library that it would be open and available to anyone here in attendance today. You just need to reach out to us and we could set up a time for you to come browse our collection and lend some books.
So I'm going to share a little bit more about the families that we serve. So all the programs that Tracy shared with you are offered at no cost to kids and families, and that includes those camps and retreats that Tracy was talking about, those overnight programs. We serve children between the ages of 3 and 18 and their families, and families is just defined by the participants. We maintain no affiliation with any healthcare system, religious group, university, or any other entity. And there's no limitation regarding the cause of death, relationship to the person, or time since the death has occurred. And the reason for that is that we understand that everybody's grief journey is unique, and so that grief services or support is needed at various different times in that journey, and everybody's relationship to the individual is unique. We recognize that participation looks different for everyone, and so our groups allow kids to lead how they want to share about their grief experience and decide when and how much they want to share in their groups and how they want to participate. And the best way to connect with our programs is to call our number. We have one phone number, and you get to speak with one of our program staff directly, and they will connect you with our programs and answer questions that you have. It's also a great resource to just, if you have questions about how to have conversations, you can just call our number. Our program staff are available to talk you through questions that you have, conversations that you want to have, and we can help support you over the phone. All of our programs are in that peer-based grief support group model, and we use different expressive tools, activities, and games to help kids process their grief and connect with other kids who are grieving and understand the pain of grief.
So next, we want to share some of the reasons why we really value telling kids about a serious illness. And we want to recognize that many caregivers and family members and community members may put a lot of pressure on themselves prior to having a serious conversation about a serious illness, such as a cancer diagnosis with a child or children. And so pacing can help. And we see this, we like to think of this as the first of many conversations that you would have with a child or children in your life. So first off, we know that children are affected by everything that happens in the family, and that children usually already know or at least know something. Kids are always paying attention. Little ears hear lots of things, and can sometimes make ideas in their mind of something that might be much worse than the truth. But they'll notice things like increased doctor's visits, changes in appetite or sleeping, changes in diet. All of those things kids are going to notice, and they're going to wonder what's going on, what those changes mean. We also want to emphasize that telling the truth to children in your life about a serious illness doesn't mean telling the whole truth right now. It means opening the door to starting those conversations with the children in your life. We also know that there is a strong desire by most caring adults to want to protect the children in their life by whatever means necessary. However, we know that kids who are deceived, lied to, and are, in other words, protected from facts may learn a lesson of distrust, which is why we always want to encourage family members and caregivers and community members to be as honest as possible and as is developmentally appropriate with the kids in their lives in regards to talking about a serious illness.
So, when deciding what to tell children about your illness, it may feel overwhelming of where to start. And so, what we've done is we've outlined three things to tell your child, no matter their age. And so, the first thing that you want to ensure to tell them is you want to tell your family member that it is a serious illness. And then you want to tell them the name of the disease. And you want to use the simplified name, so cancer. And you also want to kind of avoid some of that medical jargon when talking about additional terms, that those terms can be really large terms and confusing. And so we want to use some simplified terms to help them understand. And then the third thing you want to tell them is your best understanding of what may happen. So this may include treatments, procedures, side effects, changes in appearances, changes in routines that might happen, changes in abilities or demeanor that might exist.
So next we want to start by talking about how to get prepared for that initial conversation with the kids in your life. And this is a great way to remove some of those pressures that we talked about before that can come with feeling the weight of having serious conversations with children. So we want to remember always to use concrete language with children. Children, especially those who are younger, can have magical thinking, and words that have double meanings can become very confusing, and children may walk away with misinformation from that conversation, which we want to avoid. Um, we also want to describe the illness in terms of the body. So, talking about what part of the body is being impacted by the cancer can be very helpful to children. So, we've got two examples here. One is to use a doll or an action figure to point or show on the body of that figure the part of the body that's being affected or impacted by cancer, or where the treatment program is being targeted. Another example would be using your hands to demonstrate the difference between a large and a small sickness. We've heard that this is really helpful, especially with our younger kids. So we could talk about a small sickness, such as having a cold or a cough, and put our hands like this, just about the distance of our width of our face. And then we could talk about cancer or more serious illness by pulling our hands apart and kind of expanding that to let them know that this is a different kind of sickness and it's more serious. We also know that children will commonly blame themselves when there is a serious illness of someone important in their lives. So we have this opportunity to get prepared for our conversation with children to let them know explicitly that no one is at fault for a cancer diagnosis or any serious illness. We also want to provide basic facts and then allow the children's questions to guide on what additional information is shared. So we really want to allow the pacing to be set by the child or teen, and then really follow their lead.
So before sitting with your children, there are some ways that you can help prepare yourself for the conversation. So these are some kind of tips to help prepare yourself. So as Barb kind of mentioned, being aware of your own thoughts and feelings and reactions. So having a check-in with yourself. What am I feeling? What are the things that are currently sitting in my body right now? What are these thoughts and feelings? Checking in with yourself, knowing your own thoughts and emotions about the topic that you're about to discuss with them will help you convey that message and know how your emotions are going to be impacting that message or displaying that message. Plan for having additional support. So this is something that we really encourage for adults to have, is to have another supportive adult there with them. Someone that can either step in if the conversation leads in a way where you just need additional support to deliver the message. Or maybe somebody that can step in afterwards that can help care for the kids while you take a break after having the conversation. Somewhere having some additional support just in case you need it. And sometimes just having somebody there can be helpful. Just knowing that you have that support in your back pocket can be helpful going into the conversation to feel more confident. Practice what you want to say or convey with another individual or in front of a mirror. This is really helpful in kind of catching some of those nonverbals, those things on your face that maybe you don't want to share, or maybe you want to share differently. And so doing it in front of a mirror or doing it with another individual, they can help kind of be that balance or check for you of this is what I'm kind of seeing in the way you're saying it, or what I'm hearing in the way you're saying it, to be that support for you. Think ahead of what some likely questions are and how you would like to respond to them, and prepare for repeat questions. So it can be really helpful to think about what are some questions that your kids might ask you, and then what would be your response to them so that you can kind of prepare and not be thrown off by questions. You know your kids best, and so you might have an idea of what questions they might ask. Also, having that extra adult support, they might be able to help troubleshoot with you of some questions that they think maybe the kids might ask. So having that extra support of what do you think that they might ask, and kind of troubleshooting what those responses might be, and practicing how you might respond to some difficult questions that you might be anticipating coming your way. And then understand that depending on your child's developmental age, they may move quickly into play or another activity. Don't take that personally as if that they don't care, or that they are not upset by the news, or that they don't understand. So sometimes people think because they move quickly into play that they don't understand what was said, or that they don't understand the significance of it. Play is the way that the children work through things. And often we think about their attention span for difficult conversations to be aligned with their attention span for other things as well. So it's very common, especially our younger kids, for them to hear difficult news, but then want to quickly move into another activity, and not have a lot of time sitting in that. And that can vary so differently among kids. So, if you are telling multiple kids at the same time, it can be helpful again to have that additional support from another adult because one kid may be ready to move on to a different activity and another may need it to sit longer. And so, having additional support would be helpful at that time.
So now that we've discussed how to prepare for the actual conversations that you would be having with children in your life, we want to talk a little bit about how to prepare the environment. And this is something where you get to have a little bit more control over the situation, um, and to set up the environment to be as supportive for your conversation as possible. So we know we want to always avoid bedtime, nap time, cars, and public locations. Some of those spaces may not feel safe to hear these type of conversations. And also with bedtime and nap time, we have distractions. We're hungry or we're sleepy and we're not able to provide our full attention to the conversation. And it's just not the best timing. We also want to locate a safe and known place with comfort items if available for the child. I know one family I worked with, whenever I brought up this tip, said, "Oh, like our child loves this nook in the couch. It is their safe space. Like they love to curl up there." And they decided that that's where they would sit, was alongside the child on that nook in the couch where that child already has decided that they feel really especially safe there. We also want to encourage sitting close in proximity to the child or children and sitting at their eye level. So, a good way to think about this is sitting kind of like knee to knee with the child or children who are present, so that you really are available for what our next tip is, which is using touch during the conversation as a way to demonstrate reassurance and care. So, a warm squeeze on the shoulder can be very reassuring to a child who's hearing information that may be upsetting. Um, and then also, as Caitlin's already talked about, having those supportive adults on standby um, is part of preparing your environment. So whether or not they're in the room with you or they're in an adjacent room is up to you and your comfort level and you knowing your kids best. But knowing that those adults that you choose are adults that your kids know, care about, and trust as well is really key when choosing them.
So we shared a lot of information about how to prepare for the conversations today. But above all, these are some of our kind of takeaways for you, for these conversations. And the first takeaway is that it's okay to say, I don't know. Sometimes there are questions that we don't know the answers to, and you don't have to know the answers to all the questions. It's okay to say, I don't know the answer to that question. Maybe that's something that you can find out together. And that's something, letting them know that that's something that you're going to look into, or that, this is the plan for that question. And then there are also questions that we just will never know the answer to. And so having a conversation about that and saying, I don't know the answer to that, and, we won't know why. We like those are hard things for adults to sit with. It's also hard for kids to sit with those I don't knows. And so just acknowledging that with them, that sometimes we don't have the answers to questions. And that can be a really frustrating experience and a really hurtful experience, and being able to have honest conversations about that piece with kids. Remember that this is the first in a series of conversations with children. So Tracy has kind of already mentioned this, but this having one conversation is just one conversation there. This is going to be a series of conversation as changes do come up. It's important to have check-ins. It's important to have updates and to share. It's important to also ask questions to check in on the kids' understanding and takeaways from the conversations you're having. So asking them to kind of repeat back to you what their understanding of your illness is, or what their understanding of what the next step is in your treatment, or the next what you shared today, so that you can hear in their words that you all are on the same page, or that you have the same understanding. I know a common thing in our anticipatory grief program, in our Horizons program, is that sometimes family members have misunderstanding of what's happening. And it's because they had the same conversation, they think they have the same understanding, but somewhere along the way, there was a misunderstanding of maybe the prognosis, or maybe what's next in treatment. And so there's some miscommunication there. And so having those check-ins of what do my children understand about my illness can be really helpful in clarifying some of those things. There will never be a perfect time to share difficult information. But with the tips and the things that Tracy and I have shared, you can be prepared and feel more prepared. So some of the things that we talked about earlier on with having those check-ins with yourself and that environment, and having those reminders of, the language and practicing ahead of time, those are things that can help you prepare for the difficult conversations, but there's never going to be a perfect time. So letting that idea of, I have to have this perfect moment, letting that go. Sharing your emotions will model healthy responses to stress. So, allowing your children to know what you're feeling in those emotions, and the importance of doing that, because what it will do is help them connect to their own emotions, and that it's okay for them to express their emotions and to share them with you. And when they're having those heavy feelings, that it's okay that you're somebody they can talk to about that. And the tools that we share can help with you practicing those things ahead of time will help you with sharing those emotions without overwhelming the children with those emotions. Because that's really important in the practicing in the mirror before having the conversation, because oftentimes when we say the words out loud for the first time, or say those difficult things out loud for the first time, and we're hearing our own words saying it back to us, that can sometimes provoke emotion in ourselves. And so saying it out loud, seeing ourselves saying it, can help us get our emotions out the first time. So that way, when we're saying it to the children, it's not the first time we're saying it. And so that can help with not overwhelming the kids with that emotion, but still sharing it. And then the last one is, you are the expert of your own children. So ultimately, you know what's best. And so trust your gut. You've got this. You have all the tools, and you can lead with what your gut is saying about where your kids are going to best feel comfort, how they're going to best be comforted by this, by you in that moment. And yeah, you've got this. So We just want to thank you guys so much again for having Tracy and I here to talk about how to talk with kids about difficult conversations. And we have shared our emails and we're happy to share more. And we look forward to answering any questions that you all have too.